A very good afternoon. My name is Fahad Shahid, and we are live from Prime Health channels of our Facebook page, YouTube channel, LinkedIn, and of course, Twitter. A very warm welcome to another webinar, a very personalized webinar that we are looking forward to. Today's webinar is more about the pain management clinic that we are going to look forward to. As I would like to tell you that Prime is now providing innovative solutions for managing pain that can be implemented right away. One of the most technological advanced, minimally invasive diagnostics, non-surgical methods, and therapeutic services are provided by the pain management clinic that we have started here in Prime Hospital, which improves people's quality of life by helping them reduce chronic pain, specifically chronic pain, which people are not able to bear, eliminate medication dependency. That is very important in a supportive and caring environment that promotes the patient's recovery and well-being. So this is about pain management that we're going to talk about today. We've got the services that we have in pain management are multiple services at Prime Hospital that we're giving in. Let's say you talk about neck pain, you talk about shoulder pain, back pain, spinal arthritis, peripheral nerve pain, pelvic pain. I've got a long list here in front of me, which we are serving at Prime Hospital with regards to pain management clinic. I've got the expert here with me, I should say, who is managing the pain management clinic, and I would like to introduce here Dr. Mohammed Arshad. Doctor, thank you very much for joining us today.
Thank you.
So let me just introduce Dr. Arshad. Dr. Arshad is actually anesthesiologist, and he is having an experience of more than 30 years. He has served as an anesthesia consultant, and probably for more than 10 years he is in UAE. And one of the core services that he's providing is, of course, the pain management clinic. So, and in Prime Hospital, he is working as I said, anesthesiologist and of course consultant on pain management clinic. So Dr. Arshad, vast experience, extensive services. Thank you very much for joining us once again. We'll be talking about pain management clinic. But before we go on or ask the first question, I would want you all, whoever is watching us at the moment, please do ask questions related to pain management, which you think is important, because I know we all have some people who are with us, having extremely in a situation where the pain is really bad and depending on the medications. So today we're going to talk about all of those solutions that we can look into, and of course the services provided at Prime Hospital will be really great. Coming to the questions, I would directly not talk about it more. Doctor, talking about what is interventional pain management, if you could just give an outline of this pain management clinic.
Yeah. Actually, interventional pain management refers to some minimally invasive procedures which help in the treatment of chronic pain conditions. Because pain is managed by all doctors. The medical doctors treat with oral medications. The surgical doctors treat pain with surgery wherever it is indicated. So this interventional pain management falls in the gap between medical management and surgical management. It includes certain procedures like steroid injections, targeted steroid injections into specific area of pain, prolotherapy injections, trigger point injections, cryoablation of nerves, radiofrequency ablation of nerves, nerve blocks, and neurolytic injections, etc. So this interventional pain management is something which is done, which is done prior to, which can be done prior to as a trial prior to surgery, if surgery is indicated for certain pain conditions.
Right, doctor. Means if we can work on the cases with pain management clinic rather than going for surgery, this is what you're saying, right, doctor?
Yeah, some conditions definitely need surgery, but some conditions can be tried with interventional pain management, and if it doesn't help, then patients can consider surgery.
Right, right. I understand that. Right. Thank you, doctor. Doctor, who are the people who should consider the pain management? If you can just give a short brief on that.
Yeah, pain management refers, in this context, I am referring specifically to chronic pain. Chronic pain means chronic pain which has persisted for more than 3 months. But as a pain management expert, I am an anesthesiologist as well as a pain management expert. So we can manage both acute and chronic pain depending on the situation. In acute pain, as an anesthesiologist, we can manage the acute pain, and if surgery is, many acute pain conditions may need surgery, and if surgery is indicated, then we can carry the patient through the surgery with our anesthesia techniques, and subsequently post-operative pain also we can manage. And chronic pain is a separate issue, which particularly we manage in the I can see the patients in the pain management clinic and make a plan for them. I cannot hear you, Mr. Fahad.
I'm sorry. Thank you, doctor. Doctor, coming to the treatments in pain management. When you talk about that, doctor, what is prolotherapy in pain management?
Yeah, prolotherapy is an important part of chronic pain management. That is, it is an injection treatment that stimulates the body's natural healing response to repair injured tissues, such as ligaments, joints, tendons, etc. The affected areas are identified with ultrasound and injected with a solution that initiates repair of damaged tissues and also stimulates growth of healthy tissue to reduce pain, improve mobility, and restore function. Ozone, hypertonic dextrose, platelet-rich plasma, mesenchymal stem cells these are some of the substances which are commonly used in prolotherapy. So prolotherapy, there are mainly two types of injections that we use, either injection of steroids or injection of prolotherapy. So depending on the situation.
Right. I understand. So, doctor, when you talk about steroids, when steroids are used and when prolotherapy is used in chronic pain, like if you can just define these are the possibilities, or these are the situations when we go for prolotherapy, and these are the possibilities or situations when we go for an steroid injection. Also, I would want to ask you that steroid injections, a lot of people would think that maybe it has side effects or something. If you can just put some light on that.
Yeah. Steroids are specifically used when there is an acute inflammation to reduce the inflammatory response. Any acute or subacute inflammation is associated with the pain, then steroids will be beneficial. So in chronic pain conditions, say a back pain with radiating leg pain is usually due to inflammation of the nerves. When there is a disc prolapse, it releases some chemicals which causes chemical inflammation of the nerves, which result in severe pain radiating to the leg. So in that condition, steroids will be very much beneficial. Also, when neck pain is associated with radiating pain to the hand, then if there is if there is a disc involvement which causes this sort of pain, then steroids will be beneficial in those cases. But when pain is associated with degeneration or damage of the tissues in areas with poor blood supply, such as tendons, ligaments, etc., where the inflammation is minimal, in those cases, steroids may not help. or sometimes steroids may be tried and they may not adequately address the problem, in which case we try prolotherapy. Yeah, with regard to steroid, the problem with steroids, in interventional pain management, we inject steroids locally into the area of pain, specifically targeted steroid injection into the area of pain. We use long-acting particulate steroids commonly, which are released slowly into the circulation. So the direct side effects are not that much as taking oral steroids or intramuscular steroids or intravenous steroids. These drugs act specifically in the area of the pain for a prolonged period. There will be some absorption which happens slowly. Steroids, when chronic pain is there, steroids are definitely have an important role in relieving the pain. But we don't give it. It should not be given repeatedly, frequently. Maximum we repeat it 2 times or 3 times. And then we don't use it further. So it is always a good trial initially to try steroids. If it helps, well and good. If it doesn't, then we have to think of other options, such as prolotherapy, etc.
Right. Thank you very much, doctor. I completely understand that. Regards to both the processes that we were looking forward to. Doctor, I've got a question here because we'll be taking questions along. This is a question on the screen. If you can read it from Dr. Saima Kiran, and she says, treatment options for knee OA pain is elderly, please. What do you have to comment on that, doctor?
Yeah, osteoarthritis is a common problem in the elderly. Now, for end-stage osteoarthritis, the only definitive treatment is total knee replacement. That is at the end stage. Mm-hmm. But prior to reaching end stage, there is a long period over which patients will be having pain and not able to function optimally. So in those cases, of course, physiotherapy is very, very important. Physiotherapy, weight management, and these things are very, very important in management of the osteoarthritis pain. And if there is significant disability in the early stages, we can try platelet-rich plasma injection into the joint, which may have a beneficial effect. But when it reaches a stage of bone-on-bone osteoarthrosis, the final end stage, the patients will definitely need a total knee replacement. But in those rare patients who are unfit for surgery, who are very old and frail and unfit for surgery, there is still an option that we can do radio frequency of the nerves supplying the knee joint to provide some pain relief and make their life better.
Great, thank you very much, doctor. I've got a question here from Dr. Asia. How fast is the result of prolotherapy?
Yeah, prolotherapy does not act instantly. In chronic pain conditions, there is no magical cure. Chronic pain is something that the patients have to work together with the doctor. It takes time. Prolotherapy takes about 4 to 6 weeks to show some effect. So chronic pain management is a process. So patients should understand there is no magical bullet to just instantly relieve their problem. So it is a slow process. Sometimes one method of management does not help. Then we have to think of other options. Like that, step by step we progress. So we work together with the patients.
Right. I understand. Thank you for clarifying that. I've got another question from Dr. Asia, but before that, I would want to ask you a question, Doctor. Doctor, what is the role of nerve blocks in pain management?
Yeah. As an anesthesiologist, nerve blocks we commonly use to treat acute pain, like surgical pain or any acute pain. But in chronic pain conditions, sometimes we use nerve blocks to break the cycle of pain so that sometimes repeated nerve blocks helps in breaking the cycle of pain. And then subsequently further treatment can be planned. Also, nerve blocks are used as a diagnostic tool to diagnose what is the cause of the pain. The other thing is nerve blocks in chronic pain can also be used to help in physiotherapy.
Okay, great. Doctor, now related to the same, I've got another question from Dr. Asya coming up on the screen. Who are the people who should consider pain management first of all? And doctor, what happens during a pain block?
Yeah, any sort of pain patients can consider pain management, should consider pain management and come to should consider interventional pain management specifically. So when we see the patients, if the patient definitely needs a surgery, we will refer them to surgery. And if the patient needs only medical management, I can refer them to the medical team. Only those patients who can be who will benefit from some interventional techniques, we will proceed with that mode of treatment. So pain block, if you by pain block you mean nerve blocks, as I already said, that nerve blocks act instantaneously, and we identify the nerves with ultrasound and inject local anesthetic solution, and immediately it will paralyze the nerve, so the pain whatever will be abolished. But it is particularly used in acute pain conditions. But it wears off also in over a period of time, say 12 hours to 24 hours, the nerve block effect will completely wear off. If it is prolotherapy injection, we inject some local anesthetic and then put needles under ultrasound. We put needles into the right area where the tissue damage is there, and inject the solution, whether it is PRP or hypertonic dextrose or whatever. Subsequently, patients will have to be subjected to physiotherapy. And as I said, it is a process, it takes time.
Right, doctor, a lot of people when we say pain management clinic would start thinking that maybe if I have a pain which is definitely not bearable, I should directly visit the pain management clinic and they would just give some steroids and the pain will be relieved instantly, or in that case. So how much true is that, as you've mentioned, that it's not a magical treatment that it would quickly the pain will go away, but still I would want you to just in a layman's term, if you can just tell people about pain management when you are walking into a pain management clinic, what to expect regards to the treatment, how quick the processes are, or how quickly the pain will be relieved to the people, so that they would have this understanding when they are coming to the pain management clinic.
Yeah, if the patient has severe acute pain, then we can do something to relieve the acute pain temporarily. We can use some nerve blocks or whatever to immediately address the problem for the time being. But as I said, chronic pain will again return back. So subsequently, we can plan for some procedure which will help in management of the pain over long term. So we can depending on the patient's situation, we can plan something to help the patient right away. But as I said, steroids, suppose we inject steroids into the back for nerve-related pain, pain related to nerve inflammation. So many patients may if there is an acute inflammation, many patients get relief even immediately or within a period of 24 to 48 hours also. But when there is no acute inflammation, when it is a chronic this thing, it may not be immediate. It may take time, and we may have to repeat it. So, depending on the situation, the the time period of the relief will be different.
Great. Doctor, as you just mentioned that nerve block can be done once if the pain is not bearable. Is this a permanent treatment or just for a time being only?
As I told you, nerve blocks are very short acting. They will act only for 12 to 24 hours at the most. So the next thing is we have what is called cryoablation of nerves, in which an ice is applied, that is using a machine. The nerves are frozen. A cold temperature is applied over the nerves, and the nerves are frozen temporarily. So it acts for us for a longer period of time. Say it may act for a few weeks to a month or so. But ultimately, the function again returns back because there is no permanent damage to the nerve. Radio frequency causes permanent damage to the nerve. When we use radio frequency, it causes permanent damage to the nerve. Even though we call it permanent, it may not be completely permanent. At least for some years, it may provide pain relief. So the different methods are there, and each has its different time duration.
Correct. Doctor, I've got a question here from Rabia Ashraf, and she says, please explain the treatment of pain if patients suffering from neuropathy, how it can be overcome.
Yeah, neuropathy is of many types. So if it is a medical condition causing neuropathy, such as diabetic neuropathy, then it may need management of the medical condition, and also medications, oral medications. There are medicines oral medicines which specifically help in management of the neuropathy. If it is something that needs interventional pain management, we can see the patient and decide if the patient will be benefited by interventional pain management, then we can do something about it depending on the type of neuropathy and what nerves are affected. We can use our nerve block techniques or any other techniques to relieve the pain. But most neuropathies may be medical conditions which may need medical management.
Yeah, right. Understood. Thank you. Thank you very much, Doctor. Coming to the next question that I really wanted to ask is, Doctor, what is neurolytic injection and when it is used? It's one of the pain management treatment, I believe. So if you can just elaborate on that.
Yeah, neurolytic injections is injection of alcohol or phenol over the nerve, which causes permanent destruction of the nerve. It damages the nerve permanently. So it is particularly used in terminal cancer patients to relieve cancer pain. So neurolytic injections are mostly used in cancer pain patients, in certain specific types of cancer, particularly like pancreatic cancer, where they get severe pain arising in the abdomen, for which neurolytic injections are helpful in managing the pain.
Thank you. Doctor, does this, as you said that we are using it for cancer patients actually, does this also help to spread the cancer cells, or it just relieves the pain only?
No, it has nothing to do with spreading the cancer.
So it's a pain reliever, you can say.
It addresses the pain.
Doctor, coming to another question, and now what is, Doctor, cryoablation?
Yeah, as I already said, cryoablation is freezing of the nerve to block the nerve temporarily for a period of few weeks to a month. So it can be used in to relieve certain types of pain for prolonged periods, like some weeks or months. It can be used also in postoperative to relieve postoperative pain after total knee replacement or thoracotomies, etc. But the nerve function ultimately returns back because there is no permanent damage to the nerve. So in after a period of weeks or something, the nerve function returns back.
So can we do it again then?
Yes, it can be repeated.
Can be repeated. All right, right. Doctor, just wanted to before I ask the next question, the treatments, that kind of treatments that we've just discussed, are all of these treatments available in Prime Hospital in the in the pain management clinic?
Yes, the treatment which I discussed, such as PRP injections, prolotherapy injections, steroid injections, and neurolytic injections, nerve blocks, and cryotherapy, radio ablation. All this can be done in Prime Hospital. Yes, most of them can be.
That's great. That's great. So we've got all the services available at Prime Hospital to do this. Doctor, what is radio frequency ablation? I know you've just mentioned it back, like in a couple of answers back. I would want you to give an elaboration on that, a little brief. What is it actually?
Yeah, radio frequency, as opposed to cryotherapy, radio frequency is using heat to cause permanent destruction of the nerve. So again, like neurolytic injection, it also causes permanent destruction of the nerve. So it should be used in carefully selected patients where you want to permanently destroy the nerve, which causes the pain. So a nerve which has particular function with respect to your muscle function or movement, whatever, we cannot destroy it permanently. We should not destroy it. Then patient will not be able to use that muscle or whatever. So only certain specific nerves which only carry some sensation from an unwanted area, we can use radio frequency to ablate the nerve. So it should be used in carefully selected patients in carefully selected conditions, and after establishing a clear diagnosis, and after using previous diagnostic block to see that it really has an effect, then we can use radio frequency to manage the condition.
Understood. Doctor, for a person who really is in pain and really want a permanent solution to that, we know that we've got surgeries, we've got so many other treatments happening. When I say you come to a pain management clinic and we will relieve your pain, and so two parts of the question. One is, for how many times we can repeat the processes, be it prolation, be it this radio frequency, or be it any of the other treatment, how many times we can repeatedly do these treatments, and is there any restriction on this many times we should do it? After that, there has to be another way of treatment, or we can also say, should I say that yes, come to Prime Hospital, we've got these many services available, and we can relieve your pain permanently. What do you have to say on this? Or pain management clinic is just a temporary treatment?
Chronic pain is such a condition that we cannot, as I said, there is no magic bullet to completely clear it from this thing. Because most often, many times chronic pain is in response to aging and degeneration. So you cannot reverse aging. So we can only manage the pain to the extent that patient feels better, we can improve their mobility, we can improve their function. So in chronic pain, we think of making the lives of patients better than before. Chronic pain, as I said, it is a process in which we have to work with the patient and we provide relief to the patient, and then maybe patient gets back the pain after some time back. Again we can plan subsequent treatment depending on the condition. So even conditions in which for chronic pain conditions like back pain and this thing, when the patient undergoes surgery with the disc prolapse or whatever, patients get immediate relief. But after a few years, again, they usually have some new pain from the back or from the same condition. So there is no absolute, there is no magic bullet to completely clear everything and reverse back things to this thing. It goes as a process.
It goes as a process. I understand that what you're saying, doctor. Is there because we've spoken about pain management clinic, but more we've spoken about the chronic pain that is there. So I wanted to know, pain management clinic has some age restrictions, or it can be it's for all the ages.
No age restriction. It is for all the ages. Any patient with pain we can see, and if there is something that we can do to help them, we will do.
All right, great. Thank you very much, doctor. Very informative, specifically when you talk about prolotherapy in pain management, when you talk about neurolytic injections, or be it a cryoablation or a radiofrequency ablation. So what we understand, or be it a steroid, we've understood that there are multiple options that are there to relieve the pains, especially when you talk about chronic pains. So that's really wonderful, that I believe. Before we move towards the end of the session, I've got another question here from Dr. Asya, and I believe this is a very valid question. Does any kind of pain treatment need to be admitted, doctor?
Yeah, sometimes the patient lands up with an acute on chronic pain. Patients, that is, they have a chronic pain, and sometimes they have an acute exacerbation. They may need admission and management in the hospital until the pain can be, the acute pain can be controlled, and then subsequently they can be managed as a chronic pain. This thing. So yes, sometimes patients need admission.
All right, great. Thank you so very much, doctor, for answering all those questions. We've learned a lot, as I just mentioned, regards to the pain management, and more importantly, it was important to tell everyone out there that Prime Hospital is now having the service of pain management clinic, where all the types of treatments or managements that we've discussed today here, most of them, probably all of them, are available in Prime Hospital. And Dr. Muhammad Arshad is the one who is actually taking care of the pain management clinic, which is really great. You can always approach us on the numbers given on the screen at the bottom, specifically for the hospital, 0429297777, and Dr. Muhammad Arshad will be there to assist you. You can always have a consultation with him, and according to your pain management, we can definitely assist you at the pain management clinic. Doctor, before we close the session, I really want you to give a takeaway message from the webinar today, specifically for the people who are having pain or chronic pains, which is mostly unbearable. What do you have to say on that, when letting them come to Prime for the pain management clinic?
Yeah, the message that I have is that chronic pain patients, you need not suffer throughout your life with your pain. We can always do something to help you, but you have to be patient and you have to work with your doctor. And it's a scientific process, so we have to go through the scientific process. And again, I want to say clearly that I don't have any magical bullet for chronic pain. So nothing will work immediately, and immediately patients will not, you will not be free of pain. So it is a process. And the other thing is that whatever we can do safely for the patient, we will do to help them in their condition. And if the patient definitely needs surgery, then we will refer you for surgery. But many times patients undergo unnecessary surgery, which could have been managed with simple techniques. So that is why you should first approach a pain physician to know whether surgery is definitely indicated or something else can be done before surgery. And surgery also carries its own risk. So only when absolutely indicated, surgery should be done. Otherwise, other options should be tried. And physiotherapy is a very important part of pain management. So just some injection will not cure your pain. You have to change your lifestyle. Maybe you may have to work with a physiotherapist. And so it's pain is it needs multifaceted management. Chronic pain.
Great, thank you very much, Doctor. A very important message that you've given here. I would like to repeat that to our audience here, that Dr. Mohammad Arshad, who is the pain management physician, anesthetic doctor, he has clearly given a message to the people listening to us, that when you are looking forward to go for a surgery, if you're thinking about it, before you go for it, before multiple times it happens that unnecessary surgeries are taking place. But before you go ahead, please do consider on visiting a pain management physician. That is very important, because there is a possibility. We never say that every single case is the same, but there could be a possibility that you might not need a surgery. And with the pain management that we do, with the treatments that we've discussed today, it could have been saved, or maybe the surgery could have been saved. So that's a very important message by Doctor. Thank you very much once again, Dr. Arshad, for taking out time out of your busy schedule regards to the pain management clinic. Once again, I would like to tell everyone that Prime is now having the facility of pain management clinic led by none other than Dr. Mohammad Arshad, who is in Prime, and we've got multiple treatments in regards to the pain management, which we have discussed today in this webinar. Apart from that, the services which we include, we can take care of your neck pain, shoulder pain, back pain, knee pain, your spinal arthritis, pelvic pain. So there's a number of services that can be provided related to all of these pains that you're suffering from. So do visit us. Once again, please call or on our number 04229 at our hospital, and you will be able to book an appointment with our consultant on pain management clinic. So thank you very much for joining us today here. We will be back with another important webinar very soon. Till then, take care. Bye-bye. And Prime is all about personalized care, and this is what we always deliver. Thank you very much.
Thank you very much.